I call upon Dr. Vidya Raman, and then we'll have Radhaji and then Sandhyaji. Thank you.
Thank you, everybody, and thank you, Lalita ji, and your team for putting on this wonderful event. I'm so happy to be here, and I'm going to quickly talk about diabetes a little bit today because of its relevance in our community. 1 out of 3 adults have diabetes, of which 9 out of 10 don't even know that they have diabetes. And Asian Indians especially have the highest prevalence. And that's the reason why I decided to bring this up. Diabetes leads to heart disease, kidney failure, blindness, stroke, etc. And that's the reason why we all need to know about it. And that's what I do for a living. I treat chronic diseases in primary care. So I thought maybe we can touch base a few things that we can do, steps we can take to prevent it and have a healthy and normal life. So what causes diabetes? It's your body not making enough insulin, but it's made worse by poor food choices, sedentary lifestyle and overweight, and family history, and believe it or not, even depression causes very high incidence of diabetes.
Can you announce?
I'm so sorry to interrupt, but people are not able to hear because of the noise coming from the back. If you could please quiet down. Thank you.
The symptoms are not always very clear, and in fact, most of the time people don't even know that they have diabetes. But if it is serious enough, then some of them will have symptoms like increased thirst, urination, blood vision, etc. So the main focus would be, what can we do about this? The goal of treatment for diabetes is to maintain good normal blood sugar levels. And most of us in this age group between 30 and 45 are at very high risk of being pre-diabetic, and the only way you can find out is to ask your doctor to do a blood test and have yearly checkups. And so the treatment choices would be mainly lifestyle changes such as well-balanced diet and exercise, and with medication and stress relief. So I just wanted to focus a little bit on diet. So a well-balanced diet, what it means is a low-fat diet rich in grains, fruits and vegetables, and avoiding very starchy foods like rice, pasta, etc., and eat more of the non-starchy vegetables like spinach, kale, broccoli, green beans, etc. I know no one wants to do this, but you can try this tonight at home. Just try to reverse your plate. If you have a plate with rice on one side and all the vegetables and your roti and all those things, just reverse it and have the vegetable, the portion of vegetable the size of your rice or your roti, and have a little bit of the carbohydrate, and that really works to prevent obesity and overweight. And it should be partnered with exercise, which is the most important thing. And I think Indian women, we are so focused on our family and our career, and we never take time to do this. And this is one thing already Anita and Padma nicely brought out, and just wanted to add on to that exercise is not your daily chores, but exercise is trying to get your heart rate up to 65 to 85% of your targeted maximum heart rate, which can be calculated. It's available in the internet. It's a simple calculation, 220 minus age, and trying to do this at least for 20 minutes a day for 6 days a week, or 150 minutes per week. They say you can divide it any way you want. You can start off with just simple walking, go for a walk with a friend, making it more fun. You can sign up for races. Like she mentioned, my husband is an avid runner, and he makes us sign up for the Rock and Roll P.F. Chang Marathon every year, half marathon, which is a very doable target for a lot of us. And that makes me exercise for 3 or 4 months before the event. So just setting up targets like that and making it more interesting definitely helps. Along with this, I'll finish up soon. Just heart disease is one other thing in Indian women that I just wanted to talk about. Greater than 60% of Indian urban women in the age group of 30 to 45 are high risk for heart disease. And the risk factors are pretty much the same. The only difference is the heart disease symptoms are very different for women than men. And sometimes all they have is pain in their neck or back or arms, or excessive sweating or tiredness, or just short of breath doing simple things. So the take-home point today would be just to concentrate on lifestyle changes that pretty much can reverse, and you can lead a much healthier and happier life and help yourself and your family. And and just before I end, just a couple of more things about BMI and waist circumference. So BMI is a simple calculation of weight in kilogram by height in meter squared, and less than 25 is considered normal, and all of us should shoot for that, along with the waist circumference, which is measured by taking a tape and putting it around your mid-waist, above your hip bone, and breathe out, and more than 35 is considered very high risk for women. And so that's pretty much it, and I'd be happy to take any questions after the talks. Thank you.
Dr. Radha, would you like to address?